Multiple myeloma. As a medical student, or let's say internal medicine resident, we oftentimes miss most of the diagnosis. So here in my practice, I got to see a patient who had a GI bleeding, and everyone were thinking about the cause of GI bleeding and all those things, but we never thought of multiple myeloma, and uh, it turned out to be a multiple myeloma. So it can present with any weird symptoms, any like seemingly like normal symptom, but if you don't know the things, then you cannot think about the diagnosis and probably go through that. So I'm trying to just raise awareness about this thing exists, and if you see some of the symptoms, then even as a primary care physician or even as a medical student, sometimes you might clinch a diagnosis. So as a medical student, as I said earlier, as a medical student or intermediate resident, we might miss the diagnosis of multiple myeloma. So if we see any anemia, of course we have to do a regular workup for anemia. But if we see a constellation of symptoms, like let's say there is anemia, new onset kidney problem, high calcium level, don't forget to correct it for albumin, and then symptoms of lytic lesion in the bone. So these are the four things what we call as CRAB, where C explains for hypercalcemia, R is for new onset renal function, A is for anemia, which is usually normocytic anemia, and bone lytic lesion. If you see such symptoms, then think about multiple myeloma. And usually we think, oh, it's like the hematologist will diagnose it and all those things. Yeah, of course they will do all the necessary investigation, evaluation, biopsy and treatment, but as a medical student or as a resident, we need to be aware about these symptoms and think about multiple myeloma when you see constellation of these symptoms. So it's our job as a primary care doctors, and as always, you can only see things that you know. So it's always good to know about multiple myeloma. Hope it helps. Thank you so much.